that too.
I need a new roof line, and a new spoiler, and a new
Yep,
truck.
we can even do that too.
Okay, I get it. I suppose you can also do a radio show too, huh?
Well, as a matter of fact, join me every Monday at 10 for auto repair with personal care here on The Source.
Of course you do.
All right, 25 minutes before 8 o'clock. Thank you for tuning in this Thursday morning. Recently, my brother went through some kind of a medical procedure. He fell in the parking lot at the Walmart and hit his head. And I guess that was in October. And then from October to December, his health started going great. Something started happening to him. It almost looked like he had Alzheimer's, from what I understand. He was not always speaking perfectly. His leg was becoming non-functional or so painful he couldn't use it. Long story short, they figured out he had a brain bleed that stemmed back to that fall. Well, the brain bleed was kind of helped out, for lack of a better word, by the fact that he was using Coumadin or some kind of blood thinner, right? So then the doctors were faced with this bad situation. After they fixed the brain bleed, they said, well, we can't keep giving you Coumadin because you're going to have your can't be thin anymore because you'll bleed to death. But at the same time, if we don't, you're going to have blood clots.
Right.
So they did some kind of a procedure that I'll have to have some doctor talk about one day. But anyway, knock on wood, so far he's doing pretty good. And now we have a subject right here, deep vein thrombosis. And it says here that complications from deep vein thrombosis kills more people each year. Are you ready for this? Than breast cancer, motor vehicle accidents, and AIDS-related illnesses all combined.
Yes.
That according to the Center for Disease Control. Dr. Charles Abrams is on the phone to help us with this subject. He is the 2015 president-elect of the American Society of Hematology and a professor of medicine, pathology, and laboratory medicine, and the director of the Blood Center for Patient Care and Discovery at the University of Pennsylvania and Children's Hospital of Philadelphia. Wow, he must have a long business card.
I think so, or a huge T-shirt.
The risk factors of deep vein thrombosis and how to recognize and prevent those life-threatening blood clots. Dr. Abrams, good morning, sir.
Good morning. Thanks for letting me come on to represent the American Society of Hematology.
Oh, my goodness. Thank you. It's our honor. Are you in Pennsylvania right now?
I am. It certainly is cold here.
Yeah, well, that'll cause blood clots. You might want to move to Florida.
Thinking about it. Stay with you for a little.
A little bit of a phone thing right there, so I apologize if it sounded like I was talking over you. So what is exactly thrombosis? Let's see if we can define that word first.
Sure. When you cut yourself shaving, you need to form a blood clot right at that spot so that you stop bleeding. But if you were to form a blood clot in an area where you don't need it, that's a thrombosis. And so we worry about that if you form a clot, particularly in one of the large veins in your legs, and it gets large enough that it actually blocks the flow of blood in that leg. And so we call that a deep vein thrombosis, a clot where you don't need it.
So that could happen from a bruise?
It can. And usually, if it's going to occur after some sort of injury, it's a more major trauma, a major injury than just simply bruising yourself. Tearing a muscle, breaking a bone, being in a motor vehicle accident, those are among the risk factors that you can have.
Oh, I see. Okay. Does being sedentary create blood clots?
A little bit. Not quite as much, but certainly the longer you sit, the more likely you are to develop blood clots. And so people that take very long plane flights have a mildly increased risk for developing blood clots.
Are the legs the primary area that a blood clot would form?
Yes, that's the most common spot. But blood clots can occur in all kinds of areas, and sometimes the clots can break off from the legs. It can flow through the bloodstream and end up stuck in the lungs, and we call that a pulmonary embolism. And that's where it becomes very deadly.
Oh, my goodness.
So once they are a clot from the long plane flights, like you had just said, do those clots make themselves disappear, or do they have to be treated?
Well, they either, one of a couple of things can happen. It can either go away by itself, or it can a piece of it can break off and end up going somewhere else in the lungs, as we were just talking about. When we diagnose people with it, we always treat them, and usually it's with a blood thinner. But some people are lucky and even without treatment can survive having a blood clot.
Does water help? I'm asking this because somebody told me this, that if you drink a lot of water, it'll help, or it'll prevent it or something.
Yeah, I see that as well, but I think it has a pretty minor effect.
So when we are, as we get older, does age affect it? And the other, I guess, two questions in one. When you see somebody with what do you call it, varicose veins, are they more likely to get the blood clots?
Probably not. They're developing clots in the blood, in the veins very close to the skin, and that doesn't seem to be much of a risk factor for developing the clots that we're talking about here, which are in the deeper, much larger veins in the center of the legs. You're right that age is a risk factor. The older we get, the more likely we are to develop clots. But I'll see people who are very young, occasionally children, who develop clots. So this is a disease that can affect anyone.
When a person goes for their annual physical, are they checked out for blood clots, or is that something that we have to ask for from our physician?
Well, I think it's more important that we're aware of the symptoms of it. And so if you start to develop a sudden unexplained swelling of your leg, or it looks a little red, or it's tender, or it feels heavy, or something seems different about it, that could be a sign that you have a clot in your leg, a deep vein thrombosis. If you were to develop symptoms like sudden shortness of breath or chest pain, particularly when you take a deep breath, or you had an unexplained cough, that would be a sign that the clot has moved into your lungs, and that would be a pulmonary embolism.
Oh, wow.
Or that you just stay alert of these sorts of symptoms rather than expecting your physician to just suddenly diagnose it on you during an annual physical.
Is it easy to diagnose? Is it easy to discover?
Well, it is very easy if you think about it. I think the reason that so many people die from this disease and why it's such an awful disease, because it's completely treatable, but people don't recognize the signs and the symptoms that I just mentioned of either clots in the legs or clots in their chest. Once it's come to medical attention, it's very easy to diagnose and it's very easy to treat. But the problem is that people don't recognize it.
If a person walks every day, is that one of the ways to prevent blood clots?
Well, there are a lot of benefits for walking every day and remaining active. It's good for the heart. It's good for the joints. It has a modest effect on whether you form blood clots. But if you're walking at all, you're probably achieving the maximal benefit that you're going to get from exercise with respect to blood clots.
So if, let's say a blood clot is discovered and it's treated so that it's no longer there, do we consider that blood clot a symptom of something else? And if so, what do we need to do? Do we change our lifestyle so that we don't get any more?
Well, once someone has developed a blood clot, they're at a greater risk of developing another blood clot if they were to stop their blood thinner. And so that risk is probably about 1 out of 3 in general. It depends on why you got the clot to begin with. But as a general rule, it's about 1 out of 3. So someone who's had a clot should be especially careful of signs and symptoms of developing another clot in the future.
Well, I really appreciate the fact that you're taking time out of your day to speak to the different radio stations around the country, and that you decided that ours was one that you would speak to. Let's leave the listeners with a website that would help them if they had more questions. I guess ultimately your doctor would be the best place to go, but is there a website we can go to?
Absolutely, and you're right that speaking with your doctor probably is the best advice, but the American Society of Hematology has a terrific website that explains blood clots as well as a wide variety of other blood disorders, bleeding disorders, leukemia. It's all there, and it's as I say, we're here for our patients. It's www.hematology, abrams.org/patients with an S at the end.
Oh, okay. All right. Doctor, again, thank you for being on the air with us. And for the listeners, if we scared you, that's a good thing, because that means you're going to do something about it. Dr. Charles Abrams, thank you for what you're doing, and then you're welcome back anytime.
Thank you for your invitation.
All right. We'll take a little break, and we'll be right back.
One of the most common questions those nearing retirement are asking: will I outlive my money? Retirement questions like these and many more will be answered every Saturday morning at 9 a.m. on Planning for a Better and Safer Retirement with hosts Francois and Julian Pozenet. Francois and Julian will help you put your